Imagine you're about to step into a crowded room for a presentation. Your heart races, palms sweat, and your mind races with a million thoughts. What may go wrong? What if I mess up? What if I embarrass myself? That's stress kicking in. It's normal, even helpful, as a little stress for important tasks makes us focus and perform well. But what if this feeling goes on and on? What if it haunts you in every small situation, every day? When does normal stress turn into an anxiety disorder? And what can we do about it?
Hello and welcome. My name is Dr. M from Smart Clinic. Let's talk about anxiety disorder today.
Dr. M, what is anxiety? And how is it different than regular stress or worry?
Stress or worry is a natural response to challenges or threats in everyday life. Normal stress is a temporary state that often resolves once a trigger is removed or managed, and it leads to a positive problem-solving behavior. For example, a deadline at work might cause stress, but ultimately it helps you focus and be more productive to meet the deadline. On the other hand, stress or worry becomes unhelpful when it's very frequent or difficult to control or dismiss. Frequent or prolonged stress can also prevent positive thinking or action. Generalized anxiety disorder means feeling really worried and scared about a lot of things all the time. It's like having an alarm and alert system that's constantly going off, even when there's no danger. These feelings happen almost every day and make it hard to focus on things and perform daily tasks, like feeling anxiety when leaving the house, interacting with others, separating from someone, or doing a simple chore. You may have also experienced symptoms like feeling restless or tense, having difficulty sleeping, or feeling exhausted. The stress hormones in the body are elevated and keep the body on high alert. Generalized anxiety disorder can continue for a long time and can impact daily functioning, relationships, and overall well-being. It's important to know that having anxiety disorder is not the person's fault or a sign of weakness. It's a mental condition that needs care, just like we would need treatment if any part of our body was sick or in pain.
Dr. M, what are the symptoms of generalized anxiety disorder, and when should we seek help?
Symptoms of generalized anxiety disorder can vary from person to person. It commonly includes excessive worrying, having restlessness, difficulty in concentrating, and being irritable. You may also have a fast heart rate or palpitations, more sweating, frequent headaches, tension in your muscles, and difficulty with falling asleep. One way we assess the severity of symptoms is by using the GAD-7 questionnaire. It asks about 7 common symptoms of generalized anxiety disorder and how frequently you have experienced them in the past 2 weeks. Feeling nervous, anxious, or on edge, not being able to stop or control worrying too much about different things, trouble relaxing, being so restless it's hard to sit still, becoming easily annoyed or irritable, feeling afraid as if something awful might happen. Based on your answers, a total score is given that shows the severity of anxiety. This is a way to track the changes in the anxiety symptoms over time and with treatment. Discuss your symptoms with your doctor so it can be treated appropriately and timely.
Dr. M, how is anxiety treated? And what are ways to keep our mind healthy?
Thankfully, there are different ways to treat anxiety disorder. It involves a holistic approach that includes psychotherapy, medicines, and lifestyle changes. Let's talk a bit more about each of them. There are different methods of psychotherapy that can be helpful for anxiety. One common technique is CBT, or cognitive behavioral therapy. CBT helps to reframe our reactions to negative thoughts, behaviors, and emotions. A therapist can help you identify these negative thinking patterns and work to change them. This helps with reducing the stress and improve quality of life. The stress or emotions that you have in dealing with people can be reframed into something more positive. CBT is one of the many types of therapy techniques that are available. Often a therapist may use different techniques to make you feel better. If medicines are also needed for your treatment, then we usually prescribe a medicine of SSRI category. These medicines are also very effective in treating depression. They help reset the levels of stress chemicals in the brain and reduce the severity of anxiety symptoms and improve daily functioning. It's important to know that it may take time for these medicines to have full effect, and you will need regular follow-up with your doctor to monitor progress and adjust treatment. Additionally, some lifestyle changes are very important for good mental health. Practicing self-care routines, regular exercise, a balanced nutrition, having a good quality sleep, all play a critical role in mental well-being. Stress management methods like meditation, offering prayers, or yoga can also help. As family and friends, if we are concerned about someone who may be suffering from anxiety, then checking in with them can be an important part of getting help they need. Talking to them in a non-judgmental way with care and empathy can help reduce the stigma that many people feel when struggling with a mental health condition. Keep in mind that having anxiety is not a sign of weakness. Rather, it's a medical disorder, and it's not a person's fault. Encouraging someone to seek professional help can make a difference.
Did you know slow and deep breathing techniques can quickly help to reduce the feeling of anxiety by calming your nervous system? One breathing technique is 4-7-8 breathing. Let's try it now. Inhaling for 4 seconds. Hold your breath for 7 seconds. And exhale slowly for 8 seconds. Repeat. Inhaling for 4 seconds. Hold your breath for 7 seconds. And exhale slowly for 8 seconds. Do this 4 times to quickly decrease your heart rate, blood pressure, and racing thoughts. Stay healthy and help others stay healthy.